Well, hi everyone. I'm Dr. Mark Stengler here with our special guest, Dr. Bill Sears, well-known pediatrician, but also has authored many books on adult health as well. And his most recent book is the Healthy Brain book that he co-authored. Tremendous book on helping with mood, with cognitive function, preventing serious diseases of the brain. And we've had many different interviews with him. And this one, it covers a topic many people have questions on, and that is top smart supplements. So Dr. Sears, tell us more about your interest in using supplements beyond diet and exercise for brain health, and what type of supplements you find are effective, what the science shows, and what do you see with patients?
Well, Mark, you probably see this too. Patients come into our office with their bag of supplements. And most of those supplements go in the top end, come out the bottom end, and they never get into the bloodstream. It's a waste of money because there's no science behind them. So here's how I work my patients through how to choose any smart supplement. So what you're about to hear applies to any supplement. First of all, do you need it? Ask yourself, do I need it? Well, for food, if you eat 10, you need to eat 10 fistfuls of fruits and veggies every day. 10. So if you're a big fist or small fist, a baby or a big guy, 10 fistfuls of fruits and veggies every day, and 2 fistfuls of wild salmon every week. That's what the minimum you need for healthy brain health. Most of us don't. So I don't need it, therefore I must take it. All right. So with that in mind, my top supplement is recommended for brain health is omega-3. Omegas, the top fats in salmon. Omega-3s, DHA, and EPA. In fact, we have a whole book on that called The Omega-3 Effect. And because most of us don't eat a lot of seafood, and the plant-based, like flax oil and all, we sometimes don't convert enough. So the first thing is omega-3s. That's the #1 supplement for the brain. And another thing about salmon is very interesting. You know what makes salmon pink? The natural pigment called astaxanthin. Astaxanthin is what makes, is one of nature's most powerful antioxidants. And so if you don't eat two fistfuls of wild salmon every week, you need to take an omega-3 supplement, #1, and then a astaxanthin supplement. And my favorite is called Hawaiian Astaxanthin because it's grown naturally in lakes in Hawaii. And then the third would be fruit and vegetable supplements. And the reason for those is that you don't eat 10 fistfuls of fruits and veggies every day, therefore you need to take it in a supplement. My fourth, and you can go on our website and we have certain brand names that is most supported by science.
Or at AskDrSears.com?
Yes.
Okay.
And that's important because I teach that to the young people. I say, and they're good about this. I said, before you buy a supplement, you take out your smartphone and you look at the website. And if the website says the science behind our supplement, you read it and take it. If there's no science behind the supplement, then you don't buy it and you don't take it. So the fourth is vitamin D. Vitamin D. Vitamin D is a total body supplement. Vitamin D is good for the brain. And I tell my way to remember that is vitamin D gives you less dementia. The more vitamin D, the less dementia, losing your mind. See, the brain is a good antioxidant for the brain. And because we are indoor people now, we're indoors too much, and especially during the winter months. And then the fifth supplement would be probiotics for your second brain, your gut brain. So we have omega-3, DHA, EPA, number 1. Then we have vitamin D. We have fruit and vegetable supplements. We have Hawaiian Astaxanthin, and we have probiotics. Probiotics are simply food for your gut bugs.
And when people take these supplements, they have to realize this is something they should do indefinitely for optimal brain health. For example, I know there's research on Alzheimer's disease risk, and people with the better blood levels of omega-3s have the lower rates of Alzheimer's disease. This isn't something you take for a month or two, it changes your brain. This is something people should be doing ongoing. Would you agree with that?
Oh, I certainly. In fact, I'm glad you mentioned that, Mark, because that's why I put omega-3s number 1. There are over 20,000 medical journal articles on the head to toe value, especially the brain, of omega-3s. Now, another good thing is you can measure omega-3s now. We do that in our office. I've done it.
Yeah, we have been doing that too, yes.
100 times. But doctor, I eat enough flax oil, and I need enough hemp oil, and I need enough plant-based omegas. I said, well, that might work. Some people are high converters, and they could convert. And the reason that's important is that the smartest omegas come from seafood. Seafood. They can come from sea plants, like algae sources, but seafood, because all your plant sources of omega-3s are what we call short guys. They're 18 carbon atoms. The brain only likes tall guys, 20 and 22, EPA and DHA. So when you eat, say, flax meal, which is good, very healthy, I put in my smoothie, it has to go to the liver, and the brain tells the liver, hey, liver, I only like tall guys up here. I like the long carbon atoms. I like the 20 carbon atoms and the 22 EPA and DHA. So will you tack on a couple extra carbons down their liver and ship them to the brain? And some people can do that. Their liver listens, but not all people can. They're called low converters. And the best way to tell is measure your omega-3s, a simple little one drop of blood on a little piece of paper, and you mail it in. Most of your labs now do this, and that'll give you an omega-3 level. You want about 8% of your red blood cell to be omega-3s, and that's the best way to do it.
Right, and if you're like me, with patients, I've seen it's one of the most common nutritional deficiencies. You talk about vitamin D and omega-3, and it's very common in people, even people who think eat relatively healthy, the levels are low.
Exactly. I find this in my postpartum patients after babies. In fact, omega-3 deficiency, Mark, is one of the commonest causes of postpartum depression. And I wondered why. It makes good sense, because the little fathead, the baby, whose brain is growing so fast, is literally sucking the omega-3s out of mom, okay, during breastfeeding, and sucking all those omega-3s during the last trimester of pregnancy, when the baby's brain is growing the fastest in the whole life. So mother delivers with an omega-3 insufficiency, so her precious baby can have an omega-3 sufficiency. And then mother kind of crashes a bit after birth from an omega insufficiency. This is why all mothers during and after pregnancy absolutely must take omega-3 supplements.
Yeah, very good point. It seems like you're seeing a little bit of it in the literature now, and recommendations coming from obstetricians. I guess my concern for them is that they're recommending prenatal vitamins with some omega-3 in them. I'm concerned that those omega-3s are, number one, oxidized, not really healthy with the way they've been processed. And then number two, the amounts are so low. It seems to me, besides getting them in foods, they really need to take a high quality omega-3 rich supplement separately during the prenatal, postnatal period. Would you agree with that?
Absolutely correct. Most of your prenatals have only 200 milligrams of DHA. Easy way to remember, a gram a day. A gram a day from pregnancy throughout life, minimum. So a gram a day 1,000 milligrams, in other words, of combination DHA, EPA, and most of your prenatals contain just a couple hundred.
Right. Okay. Well, that's great advice. And everyone, check out the Healthy Brain book, which Dr. Sears helped to co-author. He wrote it with a neurologist, a neuroscientist, with his daughter who's trained in nutrition. So between the trio, it's a tremendous book that can really help you and your loved ones in their health. So check out the Healthy Brain book. And Dr. Sears, thank you for your time. I know we have many other posts with you in regards to the Healthy Brain book and many different aspects. But again, we thank you again for your time.
Thank you, Mark.